Welcome into the Family Pet Podcast, the podcast for curious pet parents, where we believe the more you know about pet healthcare, the better pet parent you can be. I'm your host, Michael Shirley, joined on video once more by Stephen. Welcome in, brother.
Yes,
We
have
showered this morning. We're
I
dressed.
shaved. I shaved this morning.
I
You
know.
did not shave.
I did not shave.
So-
The downside to not the downside to recording or putting these on YouTube, along with just our regular podcast, is that we have to look presentable, I guess.
I'm not sure how presentable either of us look, but
right.
we'll try our best.
Well, someone that looks very presentable is our guest today. We're excited to have Dr. Sam Bilko from the Veterinary Care and Specialty Group out of Chattanooga, Tennessee. She's a board-certified veterinarian in critical care.
Emergency and critical
care. So just continuing our history of getting excellent guests that are experts, much more knowledgeable than the two of us, but we're here to ask the great questions. But Dr. Bilko, thank you for joining the Family Pet Podcast today.
Thanks so much for having me. I'm excited to be here.
So we've had many different board-certified veterinarians on the show in the past, but I believe that you're our first emergency and critical care veterinarian. So what is our curious pet parents out there understand what board certified means, but what does it mean? Like, what training have you had specifically to be a critical care and emergency vet?
Yeah, so Criticalist has at least 4 years of extra training in life-threatening emergencies and then really sick patient care in the ICU. So when patients come in with an emergency, it's not usually a one-and-done thing that evening. They transfer in the ICU for ongoing diagnostics and ongoing treatment. And that's kind of our area of expertise, as opposed to ER veterinarians who can go into that right after school or have maybe one additional year of training. Our extra years give us a little bit more unique aspect to looking at the minor details.
So how do you train for something like that? Because when I think of ER medicine and critical care, I think of the crazy things that I see on TV, right? Like the dramatic case that comes in. How do you prepare for that?
Well, a lot of it is on-the-job experience. It's kind of luck of the draw, what's going to come in, and I've seen some pretty crazy and cool things. Lots of studying, of course, a lot of physiology so that you can be prepared to know what's happening on a cellular and molecular level in the moment and be trained to kind of stay calm and think about those aspects of things, not freak out when an emergency hits.
So does the body react differently in traumatic situations than it would normally? I mean, I guess normally, but like,
does the burst of adrenaline,
does that affect things?
Oh, yeah, definitely. So you can have cardiovascular changes, respiratory changes, neurologic problems, all as a result of shock. And there's lots of different types of shock, blood loss, trouble breathing, sudden like neurologic attacks on the body, like seizures. So there's lots of different ways the body can respond.
So your training helps you to look through, assess the situation in a calm way and understand what is happening with our pets in the moment when they're really hurting.
Yeah, and then the aftermath as well, because usually it doesn't just stop with the initial insult. The body takes a few days to kind of get back to where it should be and realize that the threat has been mitigated. And a lot of what I do is caring for the pet while their system is resetting as well and help their system to reset.
Now, you mentioned something of a difference between emergency and critical care. I don't know the difference. Can you walk us through a little bit? What is the difference between emergency and critical care?
Yeah, so our college is made up of both specialties in one, but we get equal training in each side. So emergency is, you're on the front lines. You see that patient when it comes through the door, maybe immediately after it's trauma or right after it's eaten something it shouldn't. And then critical care is the time it spends in the ICU, again, when its body is kind of, you've helped it through that initial emergency phase. You've stabilized it with, fluids or blood transfusion, or maybe it's had surgery. The critical care aspect involves kind of a broad look at the patient. So nutritional support, fluid balances, electrolytes, pain management is so important, mental health in the ICU. I really love that aspect of things. Kind of what happens afterwards, I think, is often forgotten about, but it's so important to recovery.
So I think back, I'm kind of thinking of an example. We had Dr. Renee Schmid with Pet Poison Hotline. And the emergency is the ingestion of the toxin and getting it out. The critical care would then be the process of stabilizing the pet after that. We've gotten the poison out, but now we still have to deal with the effects.
Yeah, exactly. So, for example, something that's really common for pets to eat is nonsteroidal anti-inflammatory drugs like ibuprofen or naproxen or something like that. When after the pet eats a bunch of that they shouldn't, they come in to see the emergency service, and that might be an ER doctor, or that might be a criticalist who's on the front lines there. That person will usually try and induce vomiting, get all that toxin out, as you mentioned. And then the pet is hospitalized and put in the ICU under the critical care department, where they go on fluid therapy to wash their kidneys out of toxin. They go on GI protectants to protect against stomach ulcers and other problems that can arise from NSAIDs. And we keep them there for the full 2 to 3 days, or depending on the toxin, how long it's going to take to truly flush it all out of their system. And of course, if they do develop problems, like you can have severe bleeding events from GI ulcers from NSAID toxicity, we give them blood transfusions and those types of things to help deal with that.
What would if a lay person, walks into their regular veterinarian, their general practitioner, and then they walked into your hospital, what are some of the main differences that they would see between those two buildings and maybe the people that are working there?
Yeah, so I think that our staff that we work with in the ECC department is really good at kind of honing in on the problem that you've come in for, asking specific and direct questions about that. So, for example, if we go back to the toxicity situation, asking like, was it ingested? Did they vomit since? Have you seen any problems arise? And less focused on kind of general history like vaccines and ear infections and that type of thing. So we try to move pretty quickly because usually these are life-threatening situations that we're dealing with, and we want to mitigate any threat as soon as possible. Your pet might be taken for immediate vitals and triage as well. So just because they're being separated from you, it's not necessarily that nobody is watching them or they're going to the back and something's happening, right? We want to make sure that they are stable to be able to wait with you, that we are intervening on an emergency as soon as possible.
Your team's not having discussions about heartworm prevention very often, huh? I couldn't fit in there.
No, and no nail trims.
No, I guarantee people ask you for nail trims, don't they?
On occasion they do. Usually it's not our highest priority because they're also there for being hit by a car or something. But
You're like, we don't need. We're amputating this foot. We don't need to trim the nails.
No
yeah. Oh my goodness.
So Michael prefaced when we were talking about emergency and what I know of emergency room is a lot from television, and you see these crazy stories about something falling off a truck and going through the windshield and impaling a person, and they've got to take them to the ER and treat them. That's just a crazy story. I just remember seeing
George Clooney walks in. Hey,
right.
Doc. Yeah. Right.
So do you have a crazy, just amazing story, one that you tell at dinner is like, man,
to really try to impress people?
This happened, and this was the craziest case we've ever seen.
Yeah, I mean, I've had a few really crazy cases. George Clooney hasn't come in on any of them, unfortunately, but so I think the coolest case I had, and not obviously cool for the dog, a lot of these things are medically interesting for us. A German Shepherd who was a house pet was protecting her family during an armed burglary, and she was shot in the head and the neck. And so she came in overnight, and I was on call, so I got called in to come and evaluate her. And she was bleeding from everywhere. We had to give her a massive transfusion, which means more than her entire volume of blood she received back in blood product because she was bleeding so profusely. She had tears in the vital structures of her neck, and so we had to do some surgery to ligate major vessels and fix the esophagus and the windpipe. And she was in the ICU for a long time afterwards with nutritional support and respiratory monitoring and all of that. But it was a very cool case, and she did live to stay with the family.
That's a good dog right there.
No doubt.
Man, that is cool. That is a cool case. One of the things that we have in our clinic is people asking the difference of emergency versus what we call urgent, what we can do in our clinic versus get in as soon as I can kind of issue from an ER critical care. What advice would you give to clients or pet owners when making those kind of considerations for scheduling up exams?
Yeah, so that's a really good question, and it can be hard to kind of figure out over the phone. And obviously, in the emergency room, we're trying to deal with the life-threatening situation. So things like internal bleeding, ate something they shouldn't, can't urinate, broken bones or trauma. So those would all be reasons to come to the emergency room, versus maybe things that you would think about that your primary care practitioner would traditionally do that kind of arise on the fly, like a urinary tract infection or an ear infection, skin stuff, that I would tend to direct people to an urgent care. And then the other thing is, how acute or chronic is the problem? Is it something that's changed like that in your pet? That's probably something pretty important, and we want to know about that. Versus maybe they've been vomiting once a day for 1 or 2 weeks. That's probably something that can wait for an initial evaluation with your primary care vet or an urgent care to kind of start a workup. Because in the ER, we don't always find answers to chronic problems if they have those more nebulous, been going on for a while type signs. We can start a workup, but we may not get your answer the way your primary practitioner might.
During 2020, 2021, we would hear a lot about that people couldn't get into their general practice, so they would just go to the ER. Has that settled a little bit? Are you still seeing people showing up for non-emergent care when you're like, hey, look, this really isn't, you don't need to be here. You need to go to your primary care veterinarian?
It's settled a little bit. I would say we still definitely get it more than pre-COVID times. And again, I just try to be upfront with those people that, we can start a workup, but we may not find an answer. A lot of those patients are very stable too. So as you said, the ER can be quite busy, and sometimes it's a little bit of a wait to be seen, and that can be frustrating. And I think that's just really important for people to know is just be patient with us, because we are still dealing with that COVID aftermath. Like the holiday weekend this past weekend was bananas. So.
I know, I forgot. I meant to take our local ER clinic some a fruit tray or something. Man, I forgot. Sorry, I was enjoying my day off. It's terrible, but I am really glad that they're there.
You can probably do it on Sunday.
I probably could take it anytime. They're there.
That's true. Yeah. Anytime.
We love food anytime.
I was going to say, what is your advice if we want to show some love to our local ER teams? What should we take them?
Well, we are always eating on the go. So as you said, any food is good. We rarely have time to stop for lunch. And honestly, just saying thank you and getting that kind of gratitude from pet parents is so meaningful to us, because a lot of times in the rush of everything, it can be forgotten about, like the ER team that kind of got your pet to the surgeon or got your pet to the ICU. And I think the nurses and the frontline staff deserve so much gratitude for what they do.
What is your advice for pet parents, things that they need to bring with them when they are coming to the veterinary ER?
All your medications would be so helpful.
Okay.
And I can't harp on that enough, because a lot of times people say, oh, he's taking the little yellow pill. And there are a lot of little yellow pills to me. So it's helpful to know how much they're getting, how frequently, when you last gave medications. If you have any old records or blood work, or you keep a folder, some people do for their pets with long-term issues, it's really helpful to have all of that information. Or even just calling your regular vet and letting them know that you're on the way so they can send any records over to us is really helpful to have in advance. Then we don't have to repeat tests or, ask the pet parent lots of questions that they might not know the medical answer to.
We spoke with a veterinary technician that worked in the ER, and she said, your phone charger, bring your phone charger. I was like, oh, I never thought of that. That was not where I was thinking. So, this is
there is a way that's helpful.
Yeah. This is a good time to remind our listeners out there to check with your primary care veterinarian and ask them if they have a mobile app or a mobile access to your pet's medical records through their practice management software. I know here at Family Pet Health, we use Pet Desk. So all of your pet's medical records are right there on your phone, including the list of medications. So your veterinarian may already have that available, and so check with them to see if they have something like that available for you.
Dr. Bilko, as you describe some of the care that is provided, I can imagine that it can be costly. And we are big advocates, proponents of pet insurance. Would you, well, I just toss out this little softball, would you encourage pet owners to consider pet insurance when factoring in emergency and critical care?
Absolutely. I mean, the more pet care specializes, the more it's turning into kind of what people go through, and a veterinary bill that you're not expecting can be very surprising. And I have insurance for my personal pets, and I've made use of it multiple times, and I work at a veterinary clinic. So I think it's really, really important to get that as soon as you get your new dog, so that there's no kind of pre-existing conditions and you get through the waiting period as soon as possible.
Yeah, I'm thinking, I've got insurance on Maverick for 3 years. I've had pet insurance on him.
You haven't used it yet.
I haven't used it a single time.
That's good. That's how insurance works.
He is but I know it's coming.
Yeah, you keep saying that.
If I keep saying it, maybe it won't happen.
That's right.
Because
Dr. Bilko, as it relates to veterinary emergency and critical care, is there any question that we should have asked you that we haven't?
I had written down about the wait times and the overload during COVID. I just wanted to remind everybody that is not quite over. So just to be patient, and we haven't forgotten about you at all.
And I don't know that that's ever going to change. I think this is the new normal. We have a lot more pets out there, and we have a lot more pet parents that are willing to provide emergency and critical care for their pets. And so when you travel to the ER, I assume that and please correct me if I'm wrong, but you see the most urgent things first, even if that comes in front of someone who's been there waiting for 3 hours. And
absolutely. So if we see like a torn toenail and a hit by car walk in at the same time, unfortunately, the dog that's been hit by a car is going to probably get evaluated first.
I would say fortunately for that dog. So unfortunately for the person that may have to wait, but you would want them to do the same for your pet. And so just provide, extend grace to the team that's there, know that they're doing their best. That's why you took your pet to the ER, was to get the best care available at the time. And so, but I do truly think that this is the new normal, that this is what it's going to be, because we have so many pet parents out there that will do anything for their pet that they can, including going to the ER. So, and referring to the critical care. So at Family Pet Health, we are closed on the weekends. We do not hospitalize anything overnight. So if we have a patient that requires critical care, we refer them someplace else at night. And so there are other offices, I think, that are doing that more and more today.
I think so.
Well, Dr. Bilko, it is time in our show that we ask you to share a fun fact with our listeners. Now, this is something that's going to help them win trivia night, or at least impress their friends and family at dinner. So what is your fun fact for our curious pet parents out there today?
All right. Well, I tried to do something a little bit critical care related. So my fun fact is that pennies minted before the year 1982 were made of copper primarily. And so when a pet ingests them, we worry about copper toxicity, and that could be a real big problem. Versus pennies minted after the year 1982 are primarily nickel and zinc, and so not such a big deal. I just think that's pretty interesting. And sometimes on x-rays, we try to zoom in really close and see what year is written on the penny to know how worried we have to be.
Oh, wow. That is really
cool.
Interesting that you could do that. Well, I have definitely learned something today. I did not know that.
So copper is toxic, but the nickel and the zinc is not as toxic.
Zinc can be as well, but in much larger quantities. Copper messes with a lot of different things in your red blood cells and different parts of your body, and we can see pretty severe red blood cell destruction and liver problems and things like that from copper toxicity.
Well, it sounds like a whole nother podcast episode there.
That's interesting.
Well, Dr. Bilko, thank you so much for joining us on the Family Pet Podcast today. I think you brought a lot of knowledge to our pet parents out there that will help them, and certainly learned a fun fact today that would help with trivia night. I might even add that into the Family Pet Health Trivia series that's going to be coming
1982
up this year.
is when the shift.
Yep. Well, one thing that's not shifting around here is our commitment to producing quality podcast episodes. We hope you've enjoyed this one. And until next time, stay curious.